Okay, we are going to get started. Thank you. It's 7 o'clock. If everyone could just make sure, double check, please, that you're on mute. There's over 100 people in here right now, and who knows how many are going to show up, but it gets to be a lot of distraction if there's unmuted lines. So a couple of housekeeping things out the gate, please. I've got a couple of requests that have already come through to record this. Don't worry about recording. I am recording it for you. So we will have a recording sent out to all of you. As long as you registered for the session, you'll get the recording tomorrow morning. Okay. And you can feel free. Beyond that, you can share that recording, friends, family, employers, financial planners, anybody you need to share it with, feel free. I was going to try, and it hasn't worked. I was going to try and stream this into our private Facebook group, but it didn't show me the buttons. So what I will do tomorrow is I will paste our YouTube link of the video. I'll just put it into the Facebook group so people can kind of come to it there if you'd like to. Now, Q&A. Let's just talk about that for a second. Go to the chat function if you would when you have a question. Okay, I will sit here as long as it takes to answer every single person's question, but I will typically answer those at the end. Okay, so it's about 50, 55 minutes to get through the content. Put your questions in. I will get through anybody's. If you have to buzz out, you can feel free to email me your question and I'll privately answer that for you. Okay. So welcome. I just want to say thank you for being here tonight. I'm Joanne Giardini-Russell with Giardini Medicare. We do hold these sessions twice a year. So this is our big September one, and then we have a big March one. And the September one is always pretty popular just because the annual election time is right around the corner, as you all know. So, we have all different types of people that can listen in. You could be 60 years old trying to prepare for this down the road. You could be 70 and still working. You could be on Medicare for the last couple of years. We get all types. So it's very difficult, obviously, to make this extremely useful for every different segment in just the short hour. Okay, that's where the Q&A I think is always really, really important because you're getting your questions answered. So that's pretty valuable, I believe. And I do see a chat. Hopefully, I'm going to make sure the chat is working. I'm going to test that. So if somebody can just please make it louder. So Annette, that's going to be on your computer. Okay, so anything on your end would be on your audio. So I'm testing just the chat that I can see your questions. If someone could just write something in there, that'd be great. Because that's going to be pretty useful at the very end. Okay, yep, thank you, Grant. Okay, perfect. Hi, Daniel. Awesome. Okay, so I'm going to kind of move that away so I can focus on what I'm talking about. Again, we'll try and make this, and I do apologize. I talk pretty quickly, but again, there's just a lot of content to get in here too. Okay, so let's just take a few minutes and talk about who we are, meaning Giardini Medicare, why we're really here tonight. Our agency, we get this question all the time, which is why I do like to address it up front. Our question is always like, well, how do you work? How do you get paid? What are you, basically? People are very surprised to learn that there are Medicare dedicated insurance agencies that just specialize in Medicare. For some reason, people don't realize they exist. We know thousands of them across the country, so we don't think it's unusual, but usually the public is like, I didn't know you guys existed or a service like this existed per se. So we handle all products related to Medicare. We do not work for the federal government. We do not work for Social Security nor Medicare. We are just a private insurance agency that helps people with Medicare products. Now, we do a lot of coaching, and you'll hear me talk about that as people go into the Medicare system. But again, we're not paid or compensated by the federal government in any way, shape, or form. Okay. So our services to the consumer, you, are free. The insurance companies are the folks that are paying us. And it's just like your car insurance, your auto insurance, your life insurance, things like that. It's just you don't ever pay your car insurance folks an extra check working with you, right? You just, you know, you sign up for the product and they are compensated. Okay. So after people are with us as clients, we offer them lifelong support. So as long as they're with us as a client, we help with billing, we help with IRMA questions, we help with, claims questions, all sorts of things. So all sorts of things, we're here for that after after the fact. So that's just a real quick thing of like how we work. Okay. Now, Medicare, as you know, I don't have to tell you, is just a confusing system. This could very well look like your mailbox if you are, especially if you're turning 65. But we're actually hearing from our clients, it's kind of funny this time of year. They're like, I can tell it's Medicare season because the phone calls are starting. And then you're starting to see TV commercials all pop up. Remember a few years ago when Joe Namath was everywhere? He's kind of toned down, which is actually kind of nice, but it's still it's out there, right? You've got call centers calling you, you've got carriers are calling you, you've got all sorts of people just trying to get your attention, get you into the latest thing. Everything is a new perk, everything's got the greatest gizmos, and they're trying to get you to call, right? They want you to call them. So when you're trying to learn, let's say you want to tune all of that out and you're just trying to figure out Medicare all by yourself. How do you do that? A lot of people assume that you can just go to medicare.gov and learn it yourself. And I will say this is a great resource tool. We use it a lot. We are in this every single day, searching drug plans potentially, things like that. The hard part is it's just not an easy, system to use as a learning tool in terms of how do you get from step A to B to C, and how do you really get all your things lined up? It's not really going to be laid out super well. Though I will say the Medicare New Handbook, which is kind of the hard copy version of this, it comes in your mailbox, and they are starting the 2026 version just came out about last week. In the last 10 to 15 days, it came out. So that is a really great booklet, believe it or not, just to sit down at the start and read the first 20 or so pages at least, because that's really where the changes are, the big content. Otherwise, there's a whole list of, things that are covered, but you can kind of search that better online. But it is nice to have that handbook in hand. So that is a great tool. Medicare comes with lots of bad information too. So you've got good information in medicare.gov. You've got really bad information sometimes places elsewhere. So I've had this up since 2019. And what I really like about this slide is this is Costco. Now, Costco is not your, lifeline to retirement or teaching you Medicare, right? But they are a big name. They are a well-read publication, I believe, because they still produce it after all these years. And people do pay attention to it, or they thumb through it and they read it. So this article years ago came out and talking about Medicare just being basically a big deal, get your Medicare right. Absolutely agree, right? I couldn't agree more. But as I read it, I looked at this first box on the upper right, and it just says, first, you need to enroll in Medicare when you're first eligible. In fact, if you postpone it, it will result in a Plan B late enrollment penalty. So that is 100% false, 100% false. And I will tell you that most people come to us way, way, way more paranoid about that Part B late enrollment penalty than they need to be. But they're all shaken up with anxiety because, oh my gosh, everyone's been telling me, and if I don't do this, I'm going to think of yourself. You're probably thinking the same thing. Oh my gosh, I have to do this. I'm going to get penalized. That remark, though, that statement right there is wrong. They are saying if you don't do it right when you turn 65 or when you're eligible, you're going to get a late enrollment penalty. Not true. Okay. And you'll see us walk through tonight situations where it is not true. Okay. So really important just to take some of the information out there with a grain of salt. The problem is you don't know which ones to take with the grain of salt versus what to listen to. That's where Medicare can be really, really difficult. So what we spend our days doing is transitioning people into the Medicare system. So as I talk through, this is kind of our normal day, right? Talking to people about what Medicare is. Do you need it? We're going to spend a little bit of time on that in the next slide. If you do need it, how do you go get it? How do you hook it up? Who do you call somebody? Do you go to an office? Do you go on the computer? What do you do? How much is it going to cost you? That's a big, big issue for people, right? Everything is costing more. The cost is huge. A lot of people actually come into the system thinking it's free or pretty darn subsidized, and it's not. So you're going to see the cost tonight. What is it going to cover? How is it going to cover everything? Is it going to cover my drugs? Is it going to cover my dental? What's going to be covered in all this stuff together? And then how do you put all those things together? What pieces do you need? Do you A, B, C, D, we have alphabet soup is commonly referred to. But then what does reality really look like? Okay, so a lot of times our clients at the end of the end of the tunnel, basically, they get through and they get their stuff all set up and they're like, "Oh, that really wasn't that bad." Because we're explaining each step of this. Here's what reality is. Here's your ID card that you need the first time you go to the doctor. And I'll tell you, everybody, just about everybody going through this process, they forget. So what's nice is that we're here at, when you do forget and say, it's an email coming back like I forgot, blah, blah, blah. And then we just have to resend what the piece it is that you forgot. But it happens to everybody. All right. So rest assured you're not unusual in that situation. But go relax. Okay. We're here to guide you going forward, but hopefully you made a good decision, while you were going through your choosing time period with an agent. But hopefully you chose wisely and then you managed from that point on. Okay. So when I talk about that important question of do I need Medicare, this part is really, really important. And what happened was we have so many people, we do a lot of social media. So on TikTok, I've been there for now for 3 years, just yakking every day, Medicare pieces of Medicare. And very often, because it's short form, little character boxes that we can write in, so many people there are just like, hey, I'm turning 65 in November. What should I do? I can't answer those questions with just that little bit of information because that's how everybody approaches us. I'm turning 65 and I'm still working. I'm turning 65 and I'm turning 65 and we can't tell you what to do with just that little information. So what we did was we made this website, doineedmedicare.com. When somebody goes there, they click on the green button and then up pops this form that's going to ask you to fill in the blanks for all the questions that we do need to know. So we need to know, are you collecting Social Security? Why is that important? Because people that are collecting Social Security prior to turning 65 years old are going to be automatically enrolled into Medicare. So if we know you're collecting benefits, we can say, well, hey, you're going to automatically be enrolled, but let's figure out if you need to keep it. Even though you're automatically enrolled, do you need to keep it? Okay, so that's a huge question. What kind of coverage do you have today? You might have COBRA, you might have employer coverage, you might have no coverage, you might have marketplace coverage, you might have a whole bunch of different things. So we need to know what kind of coverage you have. And then we also need to know, are you putting money into a health savings account? That's a big thing with Medicare. And then we want to know, do you have access to retiree coverage? Because sometimes people will want to talk about, you'll hear me talk about Plan G, Plan N, all these things that we're going to get to. But they're sitting here and they have retiree coverage with the school system, the Michigan Public School Teachers School System program. They don't need to hear about Plan G because 99.9% of those people are just going to go with the school system insurance. They don't deal with Plan G. Okay. So knowing that up front just gives them the ability really to not have to listen to me yak tonight about this stuff that they really don't need to hear because the school system's going to take care of them. That typically goes for federal insurance, TRICARE for Life, Champ VA, things like that. Okay. So it's important to know what you have access to and make sure you have access to those things. And then a key part of what we do is, are you in the process of retiring and you even need that Medicare to start? So many people are like, hey, I'm turning 65, but I'm going to work till I'm 70. You probably don't need to do anything until you're 70, believe it or not. So again, this is a whole bunch of things that we need to know. So if you fill out that form on the receiving end is I'm behind this. So in terms of answering this, do I need Medicare.com, I am the one answering your email. So you'll get something from me just like this. And we give you information. So we want you to, just really realize that we have the factoids behind it. So I don't want you, taking my word for it, but like, look, it says, here's a helpful CMS fact sheet that walks you through that. I want you to see all the links. I want you to see our videos. I want you to see, we try and do a lot of, here's the proof of this. Don't have to listen to us because we know how anxiety laden this kind of process is. And we also know that if I'm telling you not to do anything with Medicare because you're, putting money into a health savings account, and then all your friends and family and colleagues and everybody say, no, 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 that's totally wrong. You have to do this. I want to show you a document that just shows you the source of why we're saying this. Okay. We know we're right, but we want you to know that we are right. Okay. So we have lots of that kind of stuff. So we'll start walking through the basics of, hey, what is Medicare, right? So Medicare is just federal health insurance. It is not designed to pay 100% of your healthcare costs, but think about your insurance at work. It's certainly not paying 100%, right? Your ACA coverage is not paying 100%. No matter what you have, nothing's paying 100%. You're going to have some cost share. Now, it's also designed, Medicare is designed to be used in the United States. So we have lots of people that want to move overseas. So if you want to go move to Portugal for 3 years, you have to make a decision. Do you keep your Medicare intact, or do you not have it intact and then come back in a few years and have a late enrollment penalty? So it's not designed to be used there. You cannot take your insurance to Portugal and have your Medicare work. Okay. The people that are eligible for Medicare, mostly tonight, we're going to, unless I have questions at the end related to disability or a different condition, we're going to talk about age 65 and older, those of you that qualify at age 65. However, you could have people that are disabled at any age. We have 20 and 30-year-old clients that are on disability and have been. But as long as somebody has a Social Security disability income, they're approved for disability, they get a check for 24 months, and then they are able to get Medicare. Okay. Again, they may not need the Medicare, but they're offered the ability to get the insurance coverage called Medicare. And then two medical conditions, there's end stage renal disease and then ALS, which are two medical situations where people get fast tracked over to the Medicare system, okay, for coverage. But again, we're going to stick basically to age 65 plus in terms of eligibility tonight. When we talk about eligibility for what? Basically, it's for Medicare. And when I say Medicare, I'm talking about two components, two parts of this, Part A and Part B. The left-hand side here, we're going to talk about Part A for a minute, hospital insurance. So it's going to cover you if you're an inpatient at a hospital. It's going to cover you in a skilled nursing facility. It's going to provide some home health care if it's prescribed and medically necessary. That could be an in-home physical therapist, for example. Um, it could be, you're staying in a skilled nursing facility after a knee replacement, okay? But it's generally going to be a lot of inpatient, things like that. And I just want you to note here that it has a deductible and then it has copays. So this is in a situation that if somebody just has Part A and Part B, that's what they would be looking at paying. So if they literally just have A and B and nothing else at all, they go into the hospital for one night, they're going to pay a $1,676 deductible just for one night, 2 nights, three. It's per benefit period of 60 days. And then after that, there's some copays and things like that. So I just want you to see that there's cost associated with it. And then I just want you to know too that basically when you're buying a supplement or getting an advantage plan, those things are really going to make this all look different. So the cost sharing is shifts. Okay. I just want you to see this is with somebody that does absolutely nothing but A and B. Part B on the right-hand side. Part B is medical insurance that you really think of as your insurance, right? You're thinking of maybe your Blue Cross insurance. You think most people think more about the doctor visits, the CAT scans, the X-rays, the MRIs, the specialty visits, the physical therapy, and all those types of things. So most people are really thinking about Part B. So Part B is the part with premium. Part A, generally for most people, does not have a premium because you've been paying for that your entire working life, all those years that you worked, and there's a little pay stub on your pay stub, a little box that says M Care, and that's for Medicare. So that's been your Part A coverage just accruing over time. Okay. Now, Part B is different. So when you arrive to Medicare and you need or want Part B, you're going to pay a premium for that. And we'll talk about premiums in a second. But the base rate this year is $185 a month, and that's per person per month. Okay. But again, you're going to see cost sharing in terms of co-insurance on the Part B side. First, you have that deductible, which is currently $257. And then you're going to have 20% co-insurance on a whole bunch of different things. Again, those are for things that if you're not getting a supplement or an advantage plan, this is how your world would look in terms of your cost structure. Now, Part A, I always want to revisit this because a lot of people, because I put skilled nursing on that prior slide, a lot of people assume that means long-term care. Now, long-term care covers people in situations where they might be in a nursing home for 4 years or 10 years or lifetime. Who knows how long, right? Those are long-term care expenses, and they are never going to be part of Medicare. So we always are suggesting either people figure out how you're going to fund that, because a lot of people might have that happen to them. The other thing that is built into this long-term care area is something called short-term care. So, short-term care is essentially the opposite of long-term care. Long-term care is 1 year plus in terms of coverage. Short-term care is up to 1 year. So, we work with the short-term care arena to help people get things that are covered for custodial care because we get lots of phone calls where, hey, my dad fell, he needs, somebody to help with bathing and someone for dressing. So, a lot of people are hiring the services that are $30, $40 an hour and they need to pay for those. So Medicare is not going to pay for those things. Your supplement's not going to pay for that. Your Advantage plan, if they have any benefits at all for long-term care and short-term care, it's going to be extremely, extremely limited. So we offer short-term care coverage. So we just want to make a huge point of this being pointed out basically that it's not covered. So you have to either purchase coverage or come with money to pay for that or have family or somebody's going to have to do that. So it's a growing problem for sure. And the aging of the Medicare um, beneficiary population is just enormous. Currently, there's around 66 million people in Medicare. In 5 short years, by 2030, it's expected to be 79 million. So that is a huge, huge, huge aging of the population pretty darn quickly. Okay, so we can actually see this. We've seen it over the last few years really become more of a problem. So we've really started focusing on the short-term care arena. So part B, I just want you to remember something else. 80% coverage, that's it. Okay, you do not have 100% coverage. So if you have A and B and nothing else, you will have an open hole of 20% that you will be paying for. We have seen people that have a cancer diagnosis and they have surgeries and chemo and they have nothing but part A and part B. They've been paying 50, 60, $70,000 is not outrageous. Okay, they're getting bills. So you need to have, in my opinion, always need to have a supplement or an Advantage plan, and we'll walk through those and walk through the differences as we get a little bit further into this. Bad news. Original Medicare is not going to cover these things. Dental, okay? It's just not. So people come and have 3 implants and $15,000 quote, and they're not happy at all, right? Medicare is not going to cover those things. You can buy dental insurance. Okay. It's not generally, I will say, it's not as what you think it is. No one's going to really find $15,000 in coverage for the few implants, but you can get a little bit of coverage. Um, Call this crazy, but some people go overseas. They go to Mexico for dental, especially people that live in Texas and California, Arizona. They often will go across and find dental at a quarter of the cost of our country. So, and I will say, I think it's pretty great dental, but vision is not covered either. So when I'm talking about vision in this slide, I'm not talking about glaucoma or cataracts or macular degeneration. Those things will be covered. So clearly they will be covered. What's not covered is eyeglasses, contact lenses, and then your standard, sideways E, that kind of vision test you take at Costco, perhaps. Okay, those things will not be paid for. But the more significant things, the cataracts, glaucoma, that kind of stuff, that comes under your medical, and those will be covered by Medicare. Hearing aids, not covered by Medicare. Fitness benefits, not covered by Medicare. And then finally, prescription coverage is not covered by Medicare. It's a separate plan unless you have an Advantage plan and it happens to be bundled into that plan. Where do people go for advice? I just always need to address this because it's super important. So many people listen to family and friends and colleagues and Social Security and doctors and planners and all sorts of people. And I'm not saying it's bad to listen. I'm just saying there's a lot of bad information that swirls around from all of those places. We've had people come from Social Security saying, oh my gosh, they didn't tell me I needed a drug plan. It's not their job to tell you you need a drug plan. So they found out that they were going to get a penalty if they didn't get a drug plan. I'm so mad Social Security didn't tell me. Well, that, again, it's not their place to do so. So they're not going to tell you. So if you're in this, isolated chamber of information, you often can have the wrong information. We get so many calls where, hey, my brother-in-law told me to do blah, blah, blah. So I did it. And then we have to tell him he's wrong. And then he needs to go unwind everything. And then the person's angry and then has to spend all his time unwinding things with the government, which isn't pleasant either. Okay. So it's way easier, I will just tell you, to ask your questions ahead of time before you make the mistake and ask them of people that know Medicare. I'm not saying don't listen to all these places. I'm saying listen, make notes, and say, hey, my financial planner even said this. We've had financial planner offices call and say, hey, well, we told him to do part A because he has to, but then, his workplace said he can't do his health savings account anymore. Well, the workplace is right. The financial planner is wrong. So all of these places, we work with all of these units, and it's a hard thing. Okay. So just because people are doctors, I had an email today from a healthcare attorney. He said, I thought I knew a lot about this stuff. He goes, but I'm absolutely amazed at the complexity of Social Security and Medicare as he starts to go down that path. And we hear that a lot. Okay. So it's just, it's one of those things. So be careful of what you're listening to and who you're listening from. And then just ask again of the people that know the Medicare. So when somebody's eligible, right? So I'm talking eligibility essentially at 65 years old. So these are very common scenarios that I wanted to kind of go through. You're eligible for retiree coverage. I talked about the Michigan school teacher already, right? So that person, if you are out there and listening, you don't need to listen because you are literally just going to go, we are going to tell you, go to ORS. They will manage your health care and they will tell you what you need to do. Don't ask us for the timing because we don't want to screw up your plan. So you need to deal with ORS, okay? And that's same with the federal. There are hundreds of federal options. We don't work in the federal system. We cannot offer the federal insurance, so we don't know the answers to those things. So we can give you what we know in our world and give you pricing and how it works, but then you need to take it back to that retiree option and compare. And we can give you some ideas, but we don't administer those plans. So there's only so much we can do there. Lots of people are actively employed. They're 65 years old, and the common question is, hey, I'm still working at 65. What do I need to do? So we built a website that I will show you in a second. That it's called Over 20 Medicare. And because so many people are working, we just built an on-demand website that has a video all about that situation. So if you're turning 65 and if you're working for a hospital system or Ford Motor Company or anything over 20 employees, that's the video to watch. Every single piece of your questioning will be addressed in that video. We've never had anyone so far come back and say, hey, I didn't get my answer after watching it. Okay. I'll share that in a second with you. A small employer situation, totally different. So small employer situation, you have to enroll into Medicare. You have to get Part A and Part B because Medicare is primary in that situation. And here's what I mean by primary. It's a very good example that happened to us this summer. We were talking to somebody from down south who turned 65 last December, works for a small employer with like 8 people and did nothing with Medicare, nothing at all. So we always perk up with that. We're like, wait a second, didn't somebody tell you had to go get Medicare? The answer was, well, no, it's fine. And I turned 65 last year. I said, well, have you been to the doctor since last year? He said, no. Okay, so you need to go ask the group broker, the insurance company, the HR person, whoever handles it for your company. Ask them and just say, look, if I had a heart attack, would my insurance be basically paying out what I think it's going to pay? Maybe a $5,000 deductible, but basically paying for stuff, right? Or will they just say, nope, we're not going to pay 80% of that claim because you should have had Medicare? So he asked the employer, and then 3 hours later, there was an email saying, I got to go get Medicare. So this was early June. He ran off to go get Medicare. Great. Backdated to June 1st, which he was able to do, no problem. So he got his Part A and Part B started. He literally had a heart attack on June 13th. Like it's one of those things I'll just never forget the story because it was so like, you got to be kidding me. So when we got on the phone, he's like, oh, you're not gonna believe what happened to me. So anyway, it happens. And 80% of that heart attack claim, days and days in the hospital, he would have had a huge, huge, huge bill. Okay. And it happens. We see this happening. So I just want to tell you that it really does happen. ACA and marketplace, that's a situation where you have to leave the marketplace and you have to go to Medicare. Now, in the past, some people don't want to do that because maybe you have such subsidies and credits that it's only $100 a month. But as we keep seeing in the news, those are going to change, right? We're going to see people really ratchet up those premiums. So maybe Medicare becomes way more attractive and you'll be happier. But in general, most people are pretty happy about it. But at the end of the day, you do have to go to Medicare. So if you have ACA or marketplace, you're just buying your own insurance. Even if you're working, don't consider that work insurance because it's not considered work insurance. It's marketplace. Okay. Just go and get Medicare. Cobra. So Cobra is a situation just like the small employer. So if you are turning 65 and you're on Cobra insurance, you have to go get Medicare because Medicare, again, is primary. And if you don't have primary insurance in place, you're not going to have 100% coverage or what you think your coverage is going to be. Okay. Then you've got people out there that only have parts A and B, which I kind of discussed, but they need to have a supplement or something in place. But if they have A and B, again, they have just the 20% exposure and all sorts of different problems. Okay. So then we're moving on with somebody just saying, okay, I do need Medicare. But before we do that, I do want to back up and talk about the employer space again, because so many people are still working. So here are some things, some tips for you, the employer segment here, to ask yourself key questions if you are still working. So if you're on active worker insurance, I'm just telling you, you're not going to get the Part B penalty, regardless of what anyone tells you. All right. If you're working for employee coverage, you're still not getting the penalty, regardless of anybody telling you, right? You're not. So as long as you are literally on employer coverage, it could be yours, it could be your spouse's, anybody's. As long as you're on that coverage, you are not going to get the penalty. I'll say it 100 times because that really gets misunderstood constantly. But if it's your plan and you're turning 65 and you would prefer to go to Medicare, you got to stop and think, well, is anybody else on the plan? Do you have a 63-year-old spouse? Right? What's the cost? Is it $50 a month and your employer's very generous? Right? If so, we're going to just say stay on the work insurance. What if it's $900 a month? What if the employer's hardly paying anything? Those situations happen too. Also, how is your health? If you're struggling with a health issue and maybe you have bad networks with your work plan or maybe the deductible $6,000, whatever, you can go to Medicare in most situations. But don't forget, if someone else is on your plan, you might not be able to go to Medicare. So you really need to go through all that kind of stuff. Okay. Those are the things. And we have this in that on-demand video I was talking about. Also, because employer insurance and marketplace and all these things when you're prior to 65. So this is kind of for the people that are listening that are planning for Medicare down the road. Consider hospital indemnity plans, cancer plans, short-term care plans. Do those sooner than later. Number one, because your health is never going to be better than it is today, typically. And number two, a lot of the employer plans, the ACA, all these plans are just getting more expensive. Okay. More of the cost is being passed to you, the consumer. It just is. So cancer plans, they pay out $10,000 or $20,000 if you got a diagnosis. 40% of people experience a cancer diagnosis. So a lot of people, we see a lot of them paid out. Okay. So it's just ways to get extra money in your hands to help pay the cost related to all your insurance coverages. Okay. So the younger you buy them, the better it is, the cheaper it is, the better it is. And then your rates are generally locked in for life. Okay. So those are some good things to have. So this right here, you can take a screenshot with your phone if you'd like here, but over20medicare.com. Again, you're going to have the recording, but it's an on-demand one that is really worth anybody that is, hey, I'm 65 and I'm going to work till I'm 70. Watch the webinar because your questions should definitely be answered within that. Okay. Now, as we go through the whole process of somebody who needs to get Medicare, though, because the other people are working, right? They stopped, they don't need us, right? So the people that need A and B now, well, how do I do it? When we talk about A and B, just remember, I'm going to refer to this as original Medicare. Some people call it traditional. I tend to say original Medicare. Okay, that's A and B. But we want to know how much it's going to cost. Cost is a huge, huge, huge factor for everybody. This slide here is showing a person that is applying for Medicare and starting in 2025. So what happens is the federal government is going to, and this is Social Security when I say they're going to look at your income tax return from 2023. They always look back 2 years. So in 2023, they're going to take a peek at your modified adjusted gross income for 2023 because you're applying in 2025. So if they look at your tax return and you happen to file a joint return, let's say for $250,000, it's joint. Maybe your spouse worked, maybe they didn't work. It doesn't matter. You're both going to be affected by that $250,000 number. Okay. So in this, my example is just it's a $250,000 joint tax return. So this person, or these people, I should say, married, are going to pay $259 per person per month. And this is just for the Part B premium. Okay. So it's $185 is that base rate. But in this case, they're getting an IRMA surcharge. And that just means it's an additional tax, a surcharge, but it's basically penalty for higher income. Okay. And that penalty and for that level is going to be $74 per month. All right. So let's just follow along. Not only that, they're also going to get, because again, they're $250,000 joint income. they're going to pay another $13.70 per month for it's an IRMA surcharge tax on the drug plan side of things. Okay. This is not giving you extra drug coverage. It's just saying you're going to buy a Part D plan and then you're going to pay $13.70 extra to the government for having that $250,000 joint tax return from 2023. So what happens is, let's say you're retiring. So you make $250,000 in the household, and now you're retiring, and you come and people are complaining like, well, wait, that's not fair. I don't have that income any longer. This is a very, very important form to be aware of. Okay, this is a form called an SSA 44, and this is where you can make that 259 number go back down to 185 per person. So on this form, you're just going to put your name, and you're going to put your name on one form, and your spouse is going to put their name on a different form. You're going to have two forms in the household: name, social security number. You're going to box step one. You're going to choose the type of life-changing event. You're basically going back to Social Security and saying, hey, I checked the box. This happened to me, therefore I shouldn't be paying what I'm paying. In this case, you're just saying work stoppage. I retired. That is work stoppage. Date of the event, just put August 2025 is when you retired. And then you're just going to show in tax year 2025, what's your total income? Now, if you got a big giant bonus, right, for a payout at the end and all of a sudden it goes up, it's not going to work this year. But in 2026, if your income's going to be down below the threshold, the bottom threshold, you might say in 2026, it's going to be this. You would be filing that later in the year. Okay. But just know that this form can definitely, definitely be used to reduce the IRMA levels. Lots of times we'll meet people that had no idea and they just went through waiting 2 years for it finally to kind of flow back down and settle down. But it's also important to know those brackets that I just showed you with your financial folks, right? When you're looking at Roth conversions, or if you're looking at just keeping yourself in different income levels, you will affect your Medicare premiums if you and they are not paying attention completely. Okay. So anyway, we do have a nice calculator. I think a lot of people that are faced with any IRMA decision, you're going to love the calculator. Just go to that link right there and you just plug in estimated income. It's going to give you the IRMA levels. There's a video in there just showing you how to fill the form out, what to do with it. So again, just another calculator we've built that should have every answer you need about IRMA. So you'll find that we do a lot of those kind of resources. So now we get to the point where somebody has to enroll, right? So how do you actually enroll into Medicare? You know you need it. Now you know how much it's going to cost, but how much, how do you get into the system? You got a couple different enrollment periods. I'm only going to talk about two, the main ones, but there's an initial enrollment period of time. And this is those people that come like, I'm turning 65 in November. What do I do? When you're turning 65, you have the 3 months prior to your birth month, you have the month you turn 65, and then you have the 3 months after you turn 65. So everyone seems to be used to this rule or just know they decide I have to do something 3 months before my birth month. Okay. But it's simply that Medicare is just saying that, hey, if you need Medicare, if you want Medicare, this is your first stop. This is your first chance to get it. And if you do want it, you just sign up in any month of any of those windows. Okay. Anytime during those windows. If you sign up in the 3 months after your 65th birthday, you will have a delayed start a little bit, but just know anytime in this, you can just sign up. You don't need any paperwork. You don't need anything, but just go to the computer. As long as you are eligible for your credits, boom, you can just go sign up for Medicare. Okay. The second one, this is a really, really common one, is the retiring person, right? So this is the special enrollment period of time. So this is for someone that is retiring. They're leaving the hospital system, they're leaving Ford Motor Company. They're retiring from a larger employer, typically because again, they have A and B if they're on the small employer situation. This is only for getting your part B activated or your part A and B potentially. So you're using a form called an L564. And that's another one. You can Google all these forms. We actually put these forms into our Facebook group. But the form is very simply a form that goes to your employer, and you're just asking HR to essentially sign off that you and your spouse potentially, but you guys have had coverage at that employer's workplace on their coverage since you were 65 years old. That's it. They sign off. It's just a piece of paper. They indicate the dates. And then you send that or take that to Social Security Administration. You're going to request when you want your coverage to start with Medicare. So let's say you're retiring end of year this year. We get lots of right now. December 31st, I'm retiring, so and I need coverage January 1st. Very, very normal. So this right here is happening right around now. We're giving people their forms. Okay, October 1st, let's submit this. You guys get that going. You upload it to the Social Security Administration website. You're going to put on the form, hey, I want my Medicare Part B to start January 1st, 2026. And then while all of that is going on and processing, we are working with people then to get their coverage in place. Okay, do you want a Medicare supplement? What drug plan do you need? What Medicare Advantage plan do you want? What ancillary? Do you want a cancer plan? All that kind of stuff. All of that is happening while Medicare is processing your A and your B. Now, when people get the penalty is if they just didn't do this. Okay, let's say someone retires from Ford Motor Company and you technically have 8 months after that. When you leave the group insurance, you have 8 months to go get your Part B coverage. But hardly anyone does it that way. We rarely see somebody forget to just go get their Medicare set up. They just don't. They're usually the opposite. They're usually like, "Oh, next year I'm going to do this," and they're way too early. Okay, so again, that's why you just don't see that many people getting the late enrollment penalty. You just don't. Okay, usually people are way panicked about it. They're calling us in June for January coverage. So you can see it just backs right up. Okay. This ends December 31st. This new stuff starts January 1. It's pretty easy. Okay. Now, there is one little loophole as you are working, as you go on later, and we have an HSA video on YouTube that I would suggest everybody watch because I can't get into a ton of detail here, but I just want to show what happens with HSAs. So let's say you listened to us and then you didn't do anything with Medicare at age 65 because you wanted to put all this money into your HSA. And now you are going to retire. So there is a 6-month rollback window or provision, I should say, with the HSA. So what happens is, and this was a real life case, that's why I'm showing it to you here, is they received the online application in May of 2021. And then you can see Part A. Part A is going to roll back 6 months, and that's exactly what it did, as it was supposed to. So Part A started in November 2020. So this still holds true. There has been some talk and some speculation on social media saying that this has changed with the big bill that was, just brought, finalized in July from the current administration. That bill was supposed to, and it not to say it was supposed to, but it was introduced originally allowing people to get Part A and then still put money into a health savings account, but that was taken out. It did not make it till the final bill. We've seen lots of social media saying it did make it, and you could do, you could go off, and now you can do A and B and get HSA. You cannot, you cannot, you cannot, you cannot. So nothing has changed with HSAs. You cannot be enrolled in Part A or Part B of Medicare and put money into a health savings account, nor can your employer put money into the health savings account, et cetera. And then when you're ready to retire, you just want to remember the 6-month rolling back window. Okay, it's kind of confusing, but that's why I say go to the HSA video on YouTube. Okay. Now, this is where we then become agents, right? Because as I said, we just do a lot of coaching with all that kind of stuff right there was the government. So this is where we become agents and we're dealing with the products such as Medicare Advantage and Medicare supplements. So this page right here is from the Medicare and You Handbook. And I like the simplicity of it just because it clearly is just showing original Medicare on the left-hand side. Now remember, original Medicare is Part A and Part B. And it's just saying that, hey, you can go get a separate drug plan, which I said you can, and you always should, of course. But the highlighted yellow box here says you can use any doctor or hospital that takes Medicare anywhere in the United States. That, I will tell you, is the entire selling point to original Medicare plus a supplement. It is the easy button. There are no networks, no restrictions, no nothing. You can go anywhere to any doctor or hospital that takes Medicare anywhere in the United States. That's what people love about it. Okay, it says right on the bottom, you can add a supplement because remember, if you don't have a supplement, you're going to pay 20% of all the co-insurance. And if you do add the supplement, you're going to greatly reduce your cost, right? Because it's going to pay your 20%. So that's original Medicare plus a supplement and a drug plan. On the right-hand side, Medicare Advantage. And I just want you to see the words written into the Medicare and You Handbook. So Medicare Advantage is a Medicare approved. So CMS, which is Medicare, they approve the plan. So Blue Cross, Aetna, Humana, all those places, they have to submit plans and be approved by CMS, but they are private insurance companies, right? They're offering you an alternative to original Medicare. So you don't have original Medicare, okay? You still pay for original Medicare. You still pay that 185 or higher per month, but you're enrolled into a Medicare Advantage plan with a private insurance company. So they're going to deliver all of your medical differently than original Medicare does. Okay. So remember, you're just not enrolled into original Medicare for your decision making. Your decision making is going to go to the insurance company. So in many cases, you can only use doctors who are in that plan's network. And in many cases, these are the bolded parts on the right-hand side. In many cases, you may need to get approval from your plan before it will cover certain drugs or services. All right. That means prior authorization. So you've seen probably a lot in the news about prior authorization. It exists. It's not maybe as prevalent as some people think it is or experience, but it is definitely there. And you just have to know that it is there. Plans like Medicare Advantage plans, they have different out-of-pocket costs. So I'll show you some of the costs on the next slide. Some have premiums, some don't. Some include the drug plan, some don't. Some have extra benefits, some don't. So it just depends. Every single Medicare Advantage plan is very, very different. Where original Medicare plus a supplement is pretty easy. It's just original Medicare AB plus a supplement. Whereas there's a lot more moving parts to the Advantage plan side of things. Okay. So here's just kind of my example. So I highlighted on the very top the Part B premium in the yellow, because I just want you to remember that no matter which path you take, you will pay the $185 premium. Okay. So a lot of people they tend to think that, well, if they have to pay Medicare's premium, they're just going to take a zero premium PPO or HMO because they don't want to pay anything. Well, they're still paying their Part B premium. Okay, you can't get around that unless you're enrolled into Medicare and Medicaid. Medicaid. Medicaid then would pay your Medicare premium. Okay, but if you're not on Medicaid, you will be paying the 185 or higher. So just a quick example, this is just kind of a real case, right? Of the middle column is what we call Medicare supplement or Medigap Plan G. Now, Plan G is the current Cadillac of plans. It has a fee every month, and I'm just going to say a 65-year-old person in Detroit, right? Let's say they're going to pay $150 per month, okay? So they're going to pay $150 a month, and what do they get for that? They're going to get they have to pay the Part B deductible, B as in boy. So that $257 they will be paying, okay, before anything kicks in, any coverage kicks in. However, after they pay that $257, they can go to the doctors, they can go to specialists, they can be in the hospital for 6 weeks, they can have chemo and radiation, they can have skilled nursing for 96 days, they can have physical therapy 32 times, whatever, right? A lot of zeros. Because they're paying that flat fee, the supplement is handling all those costs that would be there if they didn't have the supplement in place. But note that there's no dental insurance coverage, there's no vision coverage. And then premiums for drug plans, you're going to have to add a separate drug plan. Drug plans are all over the map in terms of premium, and we can't quote a price because it's all going to depend on what medications you take. If you take Eliquis, it's going to cost more than if you take atorvastatin. Okay. Medicare Advantage on the flip side, right-hand side, you've got Medicare Advantage, which is the HMO PPO world, right? So if you're looking at your ID card, you pull it out and it says HMO or PPO Medicare plan, you have a Medicare Advantage plan. A lot of people don't even know what they have until they look at their ID card. Even then, they don't know what they have. Plans can often be zero premium. Okay. Now, I'm talking about in the past, I'm not talking about changes for 2026, but 70% to thus far have been zero premium plans, 70% of plans out there. They typically are going to have potentially no deductible. Some have a deductible. We'll see how that changes this year. They will always have a max out of pocket, which will protect you, which is a great thing. Okay, so the legal limit is $9,350 per year. So that's the legal limit that they can be. Often they are far less. The average is like 5,000 nationwide. Detroit is pretty much, maybe 3,800 to 7,000. Okay, they're going to have copays. They're going to have copays for all different things. There's a hospital copay charge per night. It could be days 1 through 5 or 1 through 3 or 1 through 7. It could be $250. It could be $400. It just depends on the plan. What is pretty consistent is chemo and radiation. It's very, very frequently going to be a 20% co-insurance charge. That, of all things, is the thing that really makes people hit that max out of pocket. Okay, so if you were to get a Medicare Advantage plan, we would always, always encourage getting a cancer plan because that's where we see absolutely the most cost. And you could have a cancer diagnosis in October and hit the max out of pocket that year, and then keep treatment going in February and March, and you're hitting it again. So it's very, very costly. So be careful with that one. Skilled nursing, Medicare is going to pay the first 20 days, but days 21 through 100 are going to have a copay with the Advantage plan. Physical therapy is typically a copay. It could be $20 a visit. It could be $45 a visit. Who knows? It's all, like I said, is very, very plan specific. And same with dental. If they offer dental, who knows what they're going to offer? Is it $500 or $1,200 or $2,000? Depends on the plan. Same with vision coverage. And then most of the time, you're going to have drug coverage built into the Medicare Advantage plan. But don't take that to mean that your drugs will be free. Okay. So some people read that incorrectly. They think zero premium for the drug plan means free drug, copays and such. And that's not the case. All right. So those are a little side by side. And now, why we kind of hone in on why we want you to understand those plans and those options is because of this reason right here. So lots of people, and I just did a TikTok a couple hours ago about this, lots of people think that the open enrollment period of time, this annual election time that's coming up, they think that they can come into this window every year from October 15th to December 7th, and they think that they can just change their plan. So if you've got somebody that comes in at 65 years old, like, hey, I'm healthy, I don't take any medications, I'm super healthy, and they stay that way for 3 or 4 years, and they get a little less healthy, maybe at age 68, 69, things start breaking a little bit, but then they have like a stent put in. Okay, year 4, there's a stent. And all of a sudden you're like, you know what? That's okay. Open enrollment, the enrollment time's right around the corner. I'm gonna change. I'm gonna get that policy that I have to pay for now, but it's gonna cover more stuff and I can go anywhere I want. Then they get denied. Okay. If someone had a stent 3 months ago, they're going to get declined. So they cannot have that Medicare supplement policy. And so many people think that they can. They think it's like the open enrollment for your work years or for Obamacare or ACA coverage. It does not work like that. So every single person starting Medicare Part B, I don't care if you're starting at 65 years old or at 72 years old, it doesn't matter. When you're basically 65 and older, and starting your Part B, as in boy coverage, you can go get any Medicare supplement that you want, any Medigap plan out there, G, N, doesn't matter, anything you want with any insurance company you want. They cannot ask you a medical question. They cannot charge you more because of your health condition. So we have people with significant pre-existing conditions. They might have cancer. They might have ALS. They might have, there's a whole bunch of things that would disqualify them from getting that supplement that we can give them within that 6-month mark. So that's why it's important to understand the rules of things. Okay. So that's where we come in. I always think of our job as like the bumper guards to everything you're doing with Medicare, right? So as we can keep you out of trouble with all of these different things. Like, can I do this? Can I do that? When can I do this? What can I do? What can I do? What should you do? What shouldn't you do? So it's really important to understand how those plans work because again, we just hear over and over like, well, I didn't know that. Nobody told me when I got this plan back when I was 65. So here's when somebody is on the Medigap side of the world and they say, well, that's the one I want. I don't want anyone telling me where I can and can't go. Plan N and Plan G are the two most popular plans, but we need to alter this slide because high deductible G is starting to be talked about more and more. High deductible G just means that instead of a $257 deductible with the Plan G, it's a $2,870 with the high deductible G. It's much cheaper. It's like $30, $40, $50 a month. And some people are really liking that, paired it up with a cancer plan and a short-term care plan. So, it can work, definitely. We have videos on that I'll show you, but this is the stuff you want to dive into after in terms of picking which plan you want. And then a couple things. So these are the people, like if you're already in the Medicare system, but and even if you're just coming into the Medicare system in the next couple of months, just know that Medicare supplement prices are increasing. They have been, the last couple of years have been ugly with Medicare supplement premiums. They have been. It's across the United States, across carriers. You definitely get some new carriers coming into the fray, but they come in cheap, and then they usually blow up in 2 or 3 years. So kind of nothing is spared out there, so it's just been a tough time. Just like you're seeing on the news about, the subsidies going away and all, the expected increases. It's just been an ugly time for healthcare. PPOs also. So if you happen to have a PPO plan with Aetna, United Healthcare, these have been on the news talking about probably 2 million people will be losing those plans, meaning the plan is being discontinued at the end of this year. So you need to know what that means to you. So if that is happening to you, and you live in any state, it doesn't matter. If you get that letter saying, hey, your coverage is ending December 31st, you have two options. And it's important to know your two options. One option is you can just go get a new Medicare Advantage plan in your zip code, anywhere just go get any plan you want. Other thing you can do is, even if you have medical conditions, you get to get a Medicare supplement with no health questions asked, because it's called guarantee issue. You have lost your coverage through no, fault of your own. So you take that letter and you get to go get guarantee issue Medicare supplement. So that becomes pretty important if it's something, if like maybe you wanted to have a Medigap plan and you've not been able to qualify for the last few years, and then all of a sudden your plan is ending. And that could be your, get out of jail free card. Okay. So just remember that it's super important to know that you have that option, especially this year when so many plans will be ending. The pricing and the coverage with drug plans is a wild swing this year. So what we've seen, we can't talk about anything till October 1st. You will see it in just 2 weeks on the computer on Medicare.gov, but you're going to see a swing in pricing and then even coverage and coverage levels. You should be able to see even your annual notice of change. If you are on a drug plan right now or a Medicare Advantage plan, the annual notice of change, we call them an ANOC, they're all hitting the mailboxes right now. And if it's not in your mailbox, you can check your online portal. But the ANOCs are coming out and you can look at things and it'll tell you all the changes. It'll say your premium this year was $2 and it's going to $36, whatever it is. Okay. Commission. So all those PPO plans that are ending, there are also millions of plans, not millions of plans, but lots and lots of plans are the insurance agent like us has been told by certain insurance companies that we're not paying you any longer to put people into these plans. That is the insurance company's way of stopping the business coming into those plans. They do not want the business. It's typically the plans that they don't want because they're losing money on. So instead of them just saying, oh, we're just going to pull the wool out, the rug out under all these people and take their plans away and give them guarantee issue, we're just going to just not pay anybody to do it. And then they're just not going to proactively market it, all that kind of stuff. They want those plans to kind of die. They will cut their benefits, right? So look at your plans this year. And then, agents being cut will affect people. So this year, very few agents are looking at drug plans. So you might end up having to look at a ship counselor. We provide a video every single year so you can watch the video. We teach people how to do that, but they don't pay for the time, the effort, the liability. We can't do that. And you'll see lots of agents kind of in the same boat. So there's a lot going on with all these different areas of insurance these days. And then ultimately, it's just the whole thing that comes down is the cost shifting to you. Like I said, it's just, I don't have to tell you that, but it's just more cost shifting. So consider all those other, those other plans that you can lock in. And unfortunately, it is something that we have to handle ourselves. So a quick little recap on Medigap. It's easy, right? Control, easy button, budgeting. You know what your budget is, even though it goes up. Nobody's happy with higher premiums, but you got to be okay with that. You have to be able to see that as a value in terms of coverage, and then just pay for it. Do the best you can in choosing up front, but you have to pay for it. And then snowbirds, right? Lots of snowbirds like for the ease of going back and forth. And especially if we have HMOs kind of making a comeback, right? HMOs are much more difficult to travel with. So we're kind of going through a little cycle there. But Medicare Advantage, I will say, for affordability, not everybody can afford Medigap, not at all. Okay. And lots of people, you're just used to networks, right? You've had them for years. You've had them through your employer. It's not a big deal. Okay. So if that doesn't bother you, then Advantage plans can win. Veterans, if you get your care at the VA, I think a great idea is always get a Medicare Advantage plan. You can get a Plan N, or you can get a Medigap, but if you're really mostly using the VA for most of your stuff, you just want to be able to come outside the VA. So you want to be able to go to civilian doctors if you want a second opinion or emergency care, things like that. So an Advantage plan could be a really good idea with that, because lots of veterans are going to get their drug coverage through the VA. But if you have that Medicare Advantage plan, you can, get some of the extra benefits that they offer. There's give back plans, which means they refund portions of your Social Security dollars. So there's just different options that are really good for veterans. And then under 65, we didn't focus on them tonight, but disability folks, they get Medicare Advantage plans because it's too expensive in Michigan and most states. And then some states you can't even get like a Plan G if you're under 65 without it being $600-700. Okay. So here's the veterans, just same thing, second opinions, things like that. I think it's a great idea always to have at least something, at least. Now let's talk about drug plans just for a couple of minutes. So drug plans, you know how I mentioned that people just are so like, oh my gosh, the Part B penalty, et cetera, et cetera. We don't see it a lot. We just don't see it a lot. Now, what we do see a lot is we absolutely see a lot of the Part D as a drug penalty. Because what happens is you have a lot of people that come in at age 65, they don't take any medications, right? Or they just say, well, GoodRx is cheaper, so I'm just going to do that. And they don't get a drug plan. If they don't get a drug plan, they're going to get a late enrollment penalty. The penalty is around 35 cents per month, and it doesn't sound like very much until it starts adding up over months and months and months. And all of a sudden it's 72. Now you need a drug plan. You come back and find that your penalty is $35 a month. That penalty never goes away. As long as you're in the Medicare system, it is staying with you every single month. Okay. The other part of not getting a drug plan that is horrible is the person that doesn't do anything. They have no drug plan. And then next June, all of a sudden they have AFib and they need Eliquis. Okay. They can't buy Eliquis very inexpensively. Okay. And they cannot get a drug plan next June. You can't get it mid-year. Okay. Check annually. So if you have a drug plan right now, make sure you're checking every single year. You're looking at that annual notice of change. And then October 1st, you're starting to look at the pricing on Medicare.gov. Here's just a little list of resources. You can find all sorts of ways to get cheaper drugs if you can. You can always do that with your, you don't have to use your drug plan. You can use GoodRx, as most of you are aware of, but then there's Cost Plus Drugs, Amazon, there's overseas pharmacies, there's a whole bunch of different ways. Manufacturer's assistance, you can type in ChatGPT and say, hey, I take Repatha, was there an assistance program, patient assistance? You can ask it and it spits out wonderful information that you can go to for there. Now, a couple of things that this is part of the Inflation Reduction Act that was passed several years ago. There is now a cap on prescription drugs. So this year, 2025, it's $2,000, but next year it's going to $2,100 out of pocket. That has been very nice for some, not so nice for others, because you're seeing potentially, other people are going to have to fund the overall cost. The insurance companies are not going to just be benevolent and say, here you go, here's a bunch of free coverage. Somebody's going to sort of pay that differential. But I will say we've had lots of people in the past that were paying $5,000, $8,000, $10,000 out of their pocket in a calendar year that this year are pretty happy at $2,000. So that will continue. It's $2,100. Medicare is negotiating 10 drugs this year. They have been negotiated, so the new pricing will start in the January 1 plans. You're going to see these on Medicare.gov as it unfolds. You'll start to see the actual pricing, so it'll be interesting. It's always kind of fun for us on October 1st to see what happens. So as I recap tonight, I hope you got these things out of it. I want you to know when or when not to enroll into Medicare. I want you to know the reason you either are or the reason you are not enrolling into Medicare. If you can speak that and get that across, we know you know why, and then you're just going to follow through. Okay. And then you can explain it to somebody else. Work with independent agents. I mean, we are free. We know the stuff. And I think it's crazy for people not to work with agents, but to each his own. And if you're retiring, start working about 4 months prior to when you need that coverage. We always need a target date. So if January 1 is your target date, early September is definitely when we're starting to work with those people. It could be even late August. And then you really, 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 as I went over here, you need to understand how both Medigap, that Medicare supplement, Remember, those are the same thing. Medigap, Medicare Supplement are the same thing, and Medicare Advantage plans, how they work, and then make sure you're choosing what works for you. Try not to get hung up on what your friend bought or what works for them, or this drug plan is great for them, or even inside your own household. You can have one spouse has Medicare Advantage and one could have Medigap, and it's okay. All right. So just make sure it works for you personally, because a lot of this stuff should just make you feel okay at night to go to sleep, right? It shouldn't be a constant worry and stressor like so many people. I've had people, I couldn't sleep last night because thinking about plans. It's just crazy. You shouldn't go through all of that. All right. And then, as always, protect yourself with the indemnity, cancer, short term care coverage, things like that. All right. So, timing. So, what we're coming up to is October 15th to December 7th. You're going to hear it all the time. I will say it sounds kind of silly, but put it in your calendar, put a big old circle around October 15th and put a double circle around December 7th. That has to be filed. So if you have a drug plan, you want to change it. If you don't change it by December 7th at midnight, you are stuck for another year. All right. Come January, February, March, if you say, I didn't know, I didn't realize the premium was changed, we see this every single year. It doesn't matter. You are stuck with that for the entire year. Okay. Medicare supplements. If you have a Medicare supplement now, you've got a Medigap plan G, and it's just like, gosh, the price has gotten high and you want to try and change to a new plan, you can do that. And you have to, most states, you're going to go through medical underwriting. Now, some states might have a birthday rule. California, Missouri has an anniversary rule. There's different rules in different states, but for the most part, you're going to go through medical underwriting to change plans. And then January, February, and March, it's kind of like a little bit of a do-over, meaning let's say you have an Advantage plan and you didn't realize, the dental benefits weren't what you wanted, or you didn't realize your doctor wasn't going to take it and you didn't check, you just didn't pay attention. And you find out in January, like, oh, my doctor doesn't take this plan now. You can actually make one change during those 3 months. Okay. It's not to be relied on. I'm not saying just ignore everything now. I'm just saying it is a backup where things can be changed. And then October 15th to December 7th and January, February, March, this is a window, a giant window basically, that allows people with an Advantage plan. Let's say you're listening and you have an Advantage plan and you're still pretty healthy and you're just like, I had no idea Medicare supplements even existed. I want that instead. And if you want to apply for that, as long as you get approved, you can do that in that giant window, October 15th. There's a small break in December and then all the way through March 31st. Get approved for the Medicare supplement, and then you get a drug plan, and that will cancel out your Medicare Advantage plan. Okay, so that's the stuff we're working on for the next 4 to 5 months. Best time to talk about Medicare before you make a mistake. Okay, before your brother-in-law, sister-in-law tells you got to do this, got to do that. Don't call or email or something just to make sure you're not going to make a mistake. We have all of our free resources here. Medicare, excuse me, Launchpad, excuse me, .com. If you go there, you'll see all of our stuff open up. You'll see the resources such as the Facebook group, which I've talked about a couple times. Great place to get all your questions. People put questions in there. We answer those. We put, like I said, we put documents, we put little videos to explain how to use a form, do things like that. So I think it's helpful just because it stays. And then you've got YouTube, so full of tons of videos. We've got high deductible G, these two, tons and tons. We got a course. You can do a transition to Medicare course. The left-hand side is a bunch of modules you can go through. But this is that Medicare, the Launchpad. The Launchpad will take you to this page essentially right here, which will lead you to everything else, the TikTok, the podcast, everything else we have. And I just want to, again, the do-it-yourselfers. I love do-it-yourself because I am a do-it-yourselfer. I will, research till the cows come home, but then I would advocate getting help when you need it. So yes, you could go to the insurance company directly, but I can guarantee the insurance company isn't going to help you down the road. So that's all. So it's great when you have research time, but it's confusing. You could get enrollment periods wrong. It's tough to kind of research some of these things. I'm all over Reddit, just answering questions too. And it's amazing how confusing those and just convoluted those threads can get. It's just crazy. So it's just, like cut to the chase. That's what we're trying to, hey, no, you don't need to do that. Just ignore this. Here's why, and just go on and come back in 3 years if you need us, that kind of stuff. So we try and be very plain English, help you avoid the cost penalties, things like that. Give you the review, the bumper guards, right? So every year we're sending videos out to our clients, just saying, hey, it's time to look at this, things like that. and just kind of keep you confident in what you got going right there. Okay. So that's just a thing. It doesn't have to be us by any means. There's hundreds of thousands actually of Medicare agents. And if we don't work in your state, or if you don't want to work with us, we can refer you to somebody else. But here's how you schedule a call. And I'm going to get right to the questions, but at the same time, I'm going to leave this up right here. And those are the states we work in. And that email address is my email. Okay. Um, so this question here, oh, I think it's just a private message, but he left. Is the presentation going to provide more information than what is in the Medicare New Handbook? I would say yes, because I think I got a lot more in depth than the handbook is going to go to. After signing up, this is Tressa. After signing up for a supplement insurance and getting your premium, can they come back after a month or so and raise the premium? Oh, typically there's going to be a 12-month rate lock on a policy, Teresa, but I think you might be asking about your health. Like if you have a surgery the month after you start, are they going to come back and raise that on you? If that's the case, then absolutely no. No, that's not going to happen, but you're definitely going to have rate increases. And I can't tell if you signed up in January, could you hit the rate increase in August? For sure, you could. Depends on what company, things like that. Oh, David Gordon, one of my favorites. Many Medicare agencies, only one Giardini Medicare. Thank you. He's a longstanding client and he is fabulous. He's a do-it-yourselfer too. Is this related to the new tax changes as well? Donna, I don't know what part you're referring to. The HSAs have not changed, but the new brackets have not come out officially for the cost of next year. I failed to mention, though, the cost of Medicare Part B premium is supposed to be 206 and 50 cents. So that's going to go up a good chunk, and all those rates are going to float upwards. What carriers are dropping Medicare Advantage for 2026? Lynn, I can't answer that. I can just say the headlines have been United Healthcare will be dropping some, Humana and Aetna will all be dropping some. Your annual notice of change, if you have a Medicare Advantage plan, will tell you if your plan is being dropped. After October 1st, you'll be able to see more online, and agents can talk about it after October 1st. Do you support enrollment into original Medicare and Medigap, or just the 20 plus Advantage plans you participate with? Do you support enrollment into original Medicare and Medigap? I'm not sure if you're asking, do we enroll? So we enroll people into Medigap plans. We help facilitate or coach you through the enrollment with original Medicare for everybody we work with. And 75% of our clients go into Medigap, Medicare supplements, and 25% go into the Advantage plans that we work with. Okay. What are the covered services shown under Part A home health care? Covered services are going to be your in-home PT, respiratory therapy, things like that. It has to be medically necessary for it to be covered services. People just presume they're going to get all this in-home care and nursing care and things like that after, and it may continue. It might start in the beginning, but it can stop pretty quickly too. So you have to be medically necessary to get that. What are the expected changes for 2026? Tanya, I think we covered most of them. The biggest change that we can talk about really are the cost shifting, and really that people have to be looking at those drug plans. We can't, because it's not October 1st, I can't show you live Medicare.gov and what that looks like, but that's going to be the biggest thing, is the shifting of the Advantage plans that will be ending and drug plans that will really be changing pretty dramatically between premiums and cost. So you have to be looking. Is the Part B deductible going up? Yes, it is. It's going up to 206.50, and that is not an official figure, but it's from the Board of Trustees report, which is pretty spot on. Okay, so just presume that's going to be right around 206.50. I guess Medigap plans must be defined by the government but offered by private carriers. Yeah, so Medigap plans are standardized by the federal government. So a G is a G is a G. So they are all identical other than price, and they are administered and provided by private insurance companies, yes. And they have to cover the same things. So you'll see a G just says, hey, you have to pay the 257 deductible, and then we'll pay everything else. Okay. But yes, they're federally standardized, and you take them with you. So if you move from one state to another, you take that with you. You just change your address. Very important, IRMA is a cliff. So if you're doing Roth conversions, know the brackets. Absolutely. Absolutely. If you're retired and you're doing Roth conversions and then 3 years later it hits you for Medicare, you cannot use that SSA 44 form. If you note on that, there is not a life event saying I did Roth conversions. So know the brackets for sure. For sure. Bill, hi Bill. In my readings, I had always associated buying a hospital indemnity plan as being a good idea if I had an Advantage plan. Are those indemnity plans also a good idea for workers over 65 remaining on the employer plan? Yeah, they are. They are because you've got the same types of the Advantage plans are very much like your work plan. It really is. Most employer plans are much like an Advantage plan. So you've got the cost sharing. So yes, so of course, if you've got indemnity, it's like you can cancel it. If you go to Medicare and get a supplement, you can cancel it if you wanted to later. But those few years, you can have it filling in things if you needed to. And then, yeah, and I got to your next point. Discontinue once leaving. Yes. Yep. 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 For sure. Good thinking, Bill. I know you're a self-studier. Can you have a cancer plan with any option you choose? For sure, Donna, you can. I will say the state of California is very strange. You can have cancer plans if you're not yet 65 years old. Say with indemnity plans, you cannot buy them at age 65 plus. So a lot of times we're catching people at 62, 63 that want them, but yes, you can have it with any option you choose. Some people just like to have it. They cover things that are non-medical. They cover, airfare if you're traveling to MD Anderson, or hospital stays. You want to fly your daughter-in-law in, stuff like that. It's just there's so many non-medical expenses that come with cancer that's where we've really seen the cancer plans be nice for people. Will the Part D $2,000 the cap continue? It's going to go, Marty, to 2,100, but yes, it is continuing. One thing we learned is Mayo Clinic in Arizona does not accept Medicare Advantage plans. Julie, the same thing is in Florida. So Mayo Clinic in Jacksonville, Florida does not accept Advantage plans. So that is a big thing you want to be careful with if you definitely want the ability to go to Mayo. And that's for people living anywhere, but especially when you are living in Arizona. And that's how we always explain, Arizona and Florida. If you're living in those places, don't think you can run up to Jacksonville with your Advantage plan and go there because they will not take any Medicare Advantage plans. Jeannie, my husband is turning 65 in November. He's under your insurance. Does he need to apply for Medigap? So this is a classic question we get. So I'm turning 60. See, he's turning 65 and he's under your insurance. So the fact, Jeannie, that he's on your insurance means he may or may not need Medicare. So what we would need to know is, is it 20 employees or more? If your employer has over 20 employees, he doesn't have to do anything with Medicare if he doesn't want to. Okay, he can stay with your insurance at work. As long as it's cheap and you're happy with it, that's fine. He can stay there. But again, if there's only 8 people employee wise, then he does need Medicare. Yes, Rick, the max goes up to 2,100. Thomas, do you operate in Pennsylvania? Yes, we do. Our agents are, several of our agents are licensed in Pennsylvania. So that should be green on the states right here. Yep. Thoughts on dental insurance? Lori, I've always been told a dentist will tell you that they're not worth anything. And then it just depends on your teeth. I see people with bad teeth that really do make out on their dental. And then there's lots of people that just have a filling every 8 years and they really don't need, they could just do, a couple pay cash for your cleanings and stuff. Always check with your dental office to see if they have their own dental little plan. Some of them will do that now for maybe 300 a year. They offer a couple x-rays and 2 cleanings, things like that. The other thing is, Lori, or anyone that is leaving employer coverage, always ask if you can take your insurance by Cobra. So maybe you can take it with you for the first 18 months. And then you can deal with whatever you want to do for dental after that. Mike, if I'm going to continue working with company supplied insurance after I turn 65, do I still need to sign up for Medicare? No, technically you do not, as long as your employer has over 20 people, Mike. Always, always, always has to be 20 or over. And technically you don't have to sign up for Part A. I would sign up for Part A as long as you're not putting money into a health savings account, because you never know if you just have that free hospital coverage kick in if you were hospitalized overnight. But as long, you don't have to do it. It would be more, that would be a want thing to do. But your thing, Mike, is going to be, are you doing an HSA, and does your employer have over 20 people? Is there someone who can speak to Social Security side of things, an agency like yours? Donna, there's not that I'm aware of agency like. It's just I do DFCU credit union. So Charles over the credit union, he does Social Security in terms of, he'll talk to people about it, but because he teaches the classes. But I don't think you'll find Social Security like agencies like ours, because then you have to be employees of the federal government, and they're not. Okay. Will Part D guidance be the same as it was last year? Choose the lowest cost plan that has all of one's meds on their insurance company's formula. Yes. Yes, Rick, identical to last year. It's always like that. And that's where people overthink it. It's basically put in your zip code, put in your medications, put in your preferred pharmacies, and then sort it and Medicare.gov is going to sort with the lowest cost for the entire year. Take that plan. That's it. As long as the meds are on it, it's going to be subjected to the cap. And then just remember it's an estimate, but yes, sort it exactly the same way. Yes. Is the cap on out-of-pocket medical on all drugs or just ones covered under Medicare? So the out-of-pocket cap, that is important, is you have to, it's got to be drugs that are covered by the plan. So if it's not a non-FDA drug and a Medicare not covered drug, then that's not going to be included in that 2100. If you get drugs from Canada, it's not included in that 2100. Okay. How soon before my retirement date should I ask my employer for the L564 form? When do they become too old to be accepted? You know, um, that's hard to say exactly. I mean, if it's within the last few months, you're totally fine. Don't forget, you're going to be billed giving the form to the employer. Not many employers we find give it to the employee. They usually receive the form and sign off, but they really don't get too old until it's, maybe you've had it filled out in January and now you're coming back in November. Okay. So, a couple months is fine, but don't let it go 6 to 9 months kind of thing. Grant, you're welcome. Oh, good, good. Everybody's getting information. Okay, hopefully you learned something at least. That's good, Donna. Thanks. So, as my understanding, my employer has to have more than 20 employees for him to not apply for Medicare if he's under my insurance. Jeannie, correct. As long as your employer has 20 or over employees, he does not have to apply for Medicare Part B. He may want to do Part A. He may not. It depends on if he's putting money into a health savings account. Karen, you're welcome. Oh, Dave Lawrence, thanks. Appreciate the help and education. Absolutely. I'm glad you guys are here and I'm glad you're learning something. I know it's a lot. It's like drinking from a fire hose. I know it's a lot. So this will be recorded. If anyone has last minute questions, I will answer those, but we will put this in the Facebook group and we will give you the recording that you are welcome to share. And then check out, again, that over 20 Medicare. Jeannie, that's a good one for you. All your answers will be in that one. Okay, so that's a good place to get all your questions. And if you still have questions after all of this, Jeannie, he doesn't have an HSA. So Jeannie, I would just have him up. I would enroll in Part A only. It's free. He gets a little hospital coverage. Why not do it? He can stay on your plan. And then when you retire or when you both lose that coverage, that's when he circles back and he gets Medicare all set up. You're welcome, Michelle. You're welcome, Karen. Thanks. You're so welcome. Good to see you, Bill. All right, so there's our states. That info@gmedicareteam.com. I answer that email. Okay, it's not to say, I won't have an agent get with you or whatever, but if it's a specific question, I'm generally just answering emails all the kind. Thomas, thanks. Thank you. Is it true you can change the supplemental policy anytime? Jim, it is true. Yes, as long as you can qualify for a new one, you can change it at any time. But if you happen to be maybe in a birthday real estate, you'll have to wait till your birthday time. But yes, you can absolutely. So this, Jim, this window coming up has nothing to do with supplements. It has really everything to do with drug plans, things like that. Okay. Let's see. There's Joanne. Thank you. Is it true? Yes. For 2025, my Medigap Blue Cross increases premium in April. That is, Kristen, that's when they do April 1st. Blue Cross always does April 1st here in Michigan. And it's going to keep going. So I don't want to get your hopes up that it's not going to happen this year because it's going to happen every year. Alyssa, thank you. Oh, good. I'm glad this helped. Comprehensive. Please share this. How to find out if your state is a birthday state. Teresa, what state? I can tell you if it is or isn't. Okay. If I'm on an employer plan, can I drop my employee coverage and have my employer pay my Medicare and Medigap premiums? Ooh, very good question. So the employer can save money. Technically, no, Roger. So I will say employers do make arrangements with people. They might increase salaries and things like that, but it's illegal, number one, for an employer to do that to save money. So they can't even do that. So tomorrow, as an example, I have 2 webinars with an employer group. Okay, they can bring people like me in to discuss Medicare, and they hope people will go to Medicare, but they can't technically reimburse the Medigap premium. They can set up, it's a long, convoluted answer, but they can set up something called an ICRA potentially. So there's different ways they can technically legally get around that. I'll say that it happens, even though maybe not supposed to happen, but in general, cost sharing is not encouraged. Of course, I mean, moving cost over to the federal government, Roger, is not, the government isn't happy about employers doing that. Okay, so they can't do that. But I'm just trying to say things things happen. Okay. You can discuss things with your employer. Does he have to get the advantage with A? No, Jeannie, he wouldn't get anything. So part A is the government. Remember, it's just part A and part B with the federal government. So it has nothing to do with the advantage or the Medigap plan. Okay. It's just part A. It's just free. He doesn't have to do it, but I would. For supplemental plans, don't you have to go through underwriting? Randy, not in the beginning. So when you're first starting your Part B coverage, that's the time when you do not have to go through any underwriting. But after that, if you come back in 2 years, yes, you have to go through medical underwriting. Or if you're trying to leave an advantage plan, you have to go through medical underwriting. Okay. Tennessee, a birthday state? No, it's not, Teresa. It's not. It has no special rules. Michigan does not have any special rules either. Florida does not have any special rules. Texas does not. A lot of states do not. Okay. There's about 10, 12 states that do have birthday rules. If you change the supplemental plan, will they conduct underwriting and consider pre-existing conditions? Yes, they will. Just about in all states other than the birthday rule states, Jim. Yes. Thank you. Awesome job. Thank you, Jim. Awesome. South Carolina, no, is not a birthday state either. Virginia just added a birthday rule. So yes, Virginia added a birthday rule this year. I'd have to look up exactly which one it is, but they just started. You're welcome, Jeannie, for sure. You are welcome. Get some of these private messages. Okay, Roger, I did answer yours. Joanne, that's good night. I would have to look, but Virginia does have a new birthday rule. They're a birthday rule state now, Mary. All right, that was the last rush of questions. 8:30, wow, that was long. You're welcome. Okay, I will just hang on here for 30 minutes. People can drop off if they see fit, and then you'll get your replay tomorrow. Jim, thanks for that. Thanks for being here for sure. This is the time of year. Bonnie, I'm 66 years old, still working, very normal, and I'm covered under my employer health insurance. However, the employee cost keeps increasing. Absolutely. Considering cost comparison between studying on employer plan and enrolling in Medicare is a the window to enroll, Bonnie, for you is technically no, but I will say ask your employer because some employers, Bonnie, will only let you leave their employer plan, like maybe November, December when their enrollment period is here. Other employers will let you leave next April or June, or it doesn't matter. But in terms of you going to Medicare, like from our end, it doesn't matter. You can go any time of the year, but I just don't want your employer to restrain you and you not know about it. So ask them first. Okay. You're welcome, Lisa. You're welcome. Bonnie, hopefully that answered your question. All right. I think we've got most people. Oh, still 50 people here. You guys are crazy. Oh, Medicare is not that exciting, that's for sure. So, all right. So I will cut out now. I'm going to get the replay going to you guys. Shoot an email over, call if you need stuff. Good luck. Protect yourself out there. All right. Good night, everybody. And thanks for being here.